Welcome to the webinar on medical commodities supply chain risk management. This webinar is being conducted by Empower with the support of a global fund who are basically and also collaborating with medical stores department. We have partnered with Global Fund to also support the capacity building of public sector staff managing public health commodities in Tanzania. And that is where this webinar is basically coming from, to ensure that the skills and capacities of public sector staff managing health commodities is being taken care of. This also basically, just to give you a brief background, Empower had implemented a phase 1 project with Global Fund where we had created 11 hours of e-learning courses, as well as trained more than 500 staff from various stakeholders, including the Ministry of Health, Pure, MSD. And the phase 2 that is being implemented currently is also being implemented with the support of all of these stakeholders. And we are also designing e-learning courses for some of the stakeholders, the information of which will be available to you by the end of the webinar. So without wasting any further time, let me directly jump. Let me again welcome you all to the webinar. We have just recently joined, and let me now jump to the housekeeping rules. So some of the ground rules that we need to establish for the webinar. Kindly keep your mic and video off during the webinar. That helps with the bandwidth. And you can ask questions using the chat box, or during the Q&A session in the end, you can actually raise your hand and ask the question. If you wish to ask a question during the Q&A session, like I mentioned, please raise your hand. When and only when you are invited to speak, please remember to unmute and turn on your video. The slide deck that is being shown will be shared with you, and a participation certificate will also be shared. So thank you so much for your patience. Just to give you a brief overview of the agenda, introduction and housekeeping, which we already dealt with. I'm going to briefly run you through the webinar objectives as well. And we're going to introduce the moderator, Dr. Gladness. We have the Acting Director of Logistics from Medical Stores Department, Tanzania, with whom we have collaborated to conduct this webinar, Mr. William Singano. He will be giving us his opening remarks. And then we have our very own favorite Professor Andy Wyckoff to help us run this session. So thank you so much, everyone, for being there. We then have the details of health commodity supply chain risk management, Q&A session, followed by making risk management work for us, followed by the second Q&A session and poll. Let me just also give you a brief background of the objectives. So this webinar seeks to address the following issues in relation to risk management, which is basically highlighting what is risk management in public health procurement and supply, and why is it needed, the basics of risk management, which applies to the healthcare PSM. Can I please ask the participants to mute themselves? If you're not speaking, please, thank you. Identifying risk, quantifying the degrees of risk and approaches to managing risks, and the impact that risk management can have on the health PSM operations. We also need to advocate for risk management application and procurement and supply chain. So these are all basically the components or aspects that we will be covering during the webinar. Prakshan, Bharat, can I please ask you to share the pre-webinar assessment, the poll, please?
Sure.
Should I stop sharing my screen?
Okay. Yes, Shiny, you can. The poll is on the screen.
So may I request all the participants to please take a minute or so to respond to the pre-webinar assessment. It's just a summary statistics that we need to understand the audience that are participating in the webinar. Thank you. It won't take too long, so please, we can give maybe 5 minutes. Thank you so much, everyone. So we have 173 participants. I'm hoping we get at least 150 out here. That's good. We have almost 50% who have responded. Another minute or so, and then we will stop the poll. "30 seconds more. People, please, who have just entered or who have not responded yet, would request you to kindly respond to the poll.
It is enough. 70% would be enough.
Yeah.
Shall we stop?
Yeah, I think, yes. I think that's all right, Friction. Yes. All right, so the poll shows that we have more number of males, almost 70-30 distribution of males and females in terms of the participation. We have people in the age group, similar percentages of people in the age group of either less than 30 or 30 to 40. And an equal percentage again of participants from Tanzania and South and Eastern Africa. We have 62% pharmacists who have joined this webinar, followed by procurement and logistics experts and warehousing and distribution managers and commodity managers. More than 40% have less than 5 years of experience, followed by 34% having 6 to 10 years of experience. So we have almost 10% gladness from MSD, if you wanted that information, and Ministry of Health and Pharmaceutical Council, almost an equal percentage of 30%. Yeah. So I think you can stop sharing the poll now, Preksha and Bharat. Let me introduce all of you now to our moderator, Dr. Gladness Salima. She is an Empower graduate, an alumni, and a senior lecturer at the University of Dar es Salaam. She has her PhD in logistics and master's in public health. She has being a public health logistician, she has published several papers and research work in health commodities supply chain. She's been a pioneer of health system reforms, particularly on strengthening health commodity supply chain management, and she's our Empower's go-to person for all the activities that are happening in Tanzania. So thank you, Gladness, for being associated with us, and I hand the floor over to you. Thank you.
Thank you very much, Shani, and welcome all of you this very important session and a very key topic as far as supply chain development is concerned. So we are so happy to have you, and we expect to have interactive sessions, questions, and sharing of experiences so that we can be able to learn from each other. Next. So I would like to introduce to you our guest speaker, and this is Mr. William Singano, who is the Acting Director Logistics from the Medical Stores Department here in Tanzania. And he is well experienced for more than 22 years in supply chain management and quality control. And he has specialized in medicines control and pharmaceutical management from 2005, when he obtained a master's degree in medicines control and pharmaceutical services from Bradford University in the United Kingdom. From 2000 to 2007, he has worked as a tutor at the Mobile Medical and Allied Health Sciences. We all know from Tanzania, this is our medical university. And from 2007 to date, he has worked with the medical stores department, where he has served as a zonal manager, you know, and for about 6 years, and quality assurance manager for about 3 years, and also again a zonal manager for 2 years, and then he's a medical programs manager from 2019 to 2021. Currently, he's the acting director, logistics, and we are so happy to have you around, Mr. William, and we expect to hear good stories from MSD this evening. So may I take this opportunity to welcome you and do an opening of this 1 hour and a half, very important intensive training. Thank you. Singano?
Can I ask Bharat or Preksha to just have the spotlight on Mr. Singano?
He's around.
Thank you very much, Dr. Salema. We at MSD are very glad to be part of this training, interactive training, and we look forward to have an interactive and sharing of experiences. As you could see, a number of participants from medical stores have logged in through this workshop. And as the strategic store in Tanzania dealing with medicine and medical devices, we look forward to strengthen our experience and knowledge on this area by having this interactive workshop. And we look forward to learn and share experiences from this end as the time would allow. So thank you very much. We are very happy to be part of this workshop, and we really appreciate being included into this workshop. And we give thanks to Dr. Salema for being with us in this endeavor of improving our supply chain management in our area, and particularly in addressing some of the risks which are common to all who are participating in this area of supply chain. Thank you very much.
Thank you very much, Singano. And maybe I should also welcome all the MSD staff that we expect you also be able to share your experiences, ask questions. It's very important. We have experts on board, so please take this opportunity to make sure that we are going to learn, but beyond learning, yeah, we can be able to establish what we should do next after this particular session. Thank you very much, Singano.
Thank you.
Next. So I would like now to introduce our main speaker, and this is our expert from Empower, and he's a global expert, Professor Andy. He's a professor of public health and director of training at the Empower School of Health, and he's one of the co-authors of the Yellow Book Yeah, those who we are interested with a supply chain management of the medical commodities, we all know the Yellow Book. Yeah, and so he's one of the co-authors. And the book is called Managing Drug Supplies, which was published by MSH, that is Management Science for Health, and WHO. And also he has also been engaged in as a co-author for an e-handbook of health systems in action for managing medicine. So he has a quite diverse and intense as far as health commodities supply chain is concerned. Professor Andy has more than 30 years of experience of working in healthcare procurement in supply chain, not only in the developed world, but also in low and middle income countries. And the main focus of his experience has been on effective management of pharmaceuticals, vaccines, and medical commodities. And particularly, he has been engaged in the implementation of programs for the introduction of new medicines and rapid diagnostics for neglected tropical diseases. And he has presented on risk management in health procurement and supply chain in many conferences, seminars, and webinars, the same as what we are going to have today. And for that case, what I could say is also he's also very experienced in facilitating trainings in risk management, even from Empower School of Health, where they have a master's degree course in health procurement in supply chain management, but also he's also teaching in the postgraduate diploma. So with these remarks, I would like to welcome Professor Andy.
Greetings to all. If we can stop sharing screen, and I'll share from my machine now, please. Do. Okay, greetings to all and many thanks. I'm going to talk quite quickly. I'm going to go through very fast because I want us to have some time for discussion today. But you will get the slide deck. You will be able to reference all the material. So my first point about risk management for public health supply chain is it's not new. We have references from 2000, yes, 2000 years ago, about how to use risk management on medical supplies. That's from the Roman army. In those days, the medical supplies were oil and vinegar rubbed into wounds, but they were still worried about running out of stock, and they used risk management techniques. Slightly more recently, we wrote the Yellow Book and, of course, the JSI Logistics Handbook as well. So this is not a new subject, and yet it's still very little known. Far too often, there's a lot of misunderstanding around risk management and supply chain. Many people will say, well, we've always had risk. There's nothing we can do about it. We can't stop a volcano. We can't stop a tsunami. All this risk management, look at all these formula on the screen here. They're all far too complicated for what we're doing. We don't even know what data analytics means, let alone be able to use it for risk management. And we don't have much reliable data on our supply chain anyway. How can we possibly do this really complicated risk management? And the key message I want to give today is it doesn't need to be complicated. It really can work. There are basic, simple management systems we can adopt to make it a lot better. You don't need to be a management theory expert. You don't need an MBA. It helps if you've got one, but you don't need one. You don't need to be a big data analytics whiz kid. You don't need massive resources to undertake risk management. These simple risk management systems, which are very well established, work. They reduce the risk, they improve the operation of the supply chain. So our key message is you don't need to be an expert to make it work. All you need is a little bit of knowledge, which we'll go through shortly. Well, why are we talking about all this risk management now? Well, of course, the obvious answer is COVID, because COVID has really highlighted how very, very fragile our supply chains had become. COVID didn't create the problems. The problems were largely already there. It highlighted the problems. And the problems we've had is for years. We've had a drive for efficiency and cost saving. And we've cut and cut and cut and gone for the cheapest product every time. But such an approach is not free. It makes our supply chains very fragile, very brittle. They can easily snap. And COVID has demonstrated just how brittle and fragile they've become. We can use risk management as a tool to try to bring our supply chains back into balance. In a little while, we're going to have the first Q&A session. But before we do, I want you now to start thinking about, as I'm talking and presenting, how long, how often have you been out of stock this year of ARVs or antimalarials, of TB medicines, or of other essential medicines? That's the impact of COVID on us. How much have we been out of stock because we weren't ready, we weren't prepared? Would it have helped if we'd have had more buffer stock? Would it have helped if we'd have had more sources of supply? Would it have helped if we had faster lead times? Just think about those areas together, the problems and the possible solutions, and we'll discuss them in the Q&A session. When we start to implement risk management, a lot of people will tell us, oh, we can't do it. We're too busy. We're in a crisis. We're already overloaded. We can't possibly take time to discuss all these things. And like the man bringing the wheel, if you don't have time for new technology, it will supersede you. We're having frequent stockouts, emergency buys, all the symptoms of a weak and brittle supply chain. We have to make it better. Risk management is a tool that can make it better, but it's still little known and very little implemented. We start by defining what do we actually mean by risk. And we define risk as the probability. How likely is this to happen? If I'm shipping goods around the world, how likely is it the ship will sink? Well, it's not very likely, but it's possible. Perhaps 1 in 100,000 might happen. That's the probability, multiplied by the consequences. What would happen to me and my supply chain if that happened? If the ship carrying all my supplies sank, that would be catastrophic for me. I'd have no supplies. I'd have to try and scramble to reorder more supplies and replace them. So we measure risk by the probability, how likely, and the consequences, how serious is it, and we multiply the two together to give us the risk factor. And I'll explain in more detail in part 2 how we do that. The point about risk management is to understand it's a formal, documented approach, a whole system to identify the sources of risk and help to reduce the risk and the consequences of the risk, a technique we call mitigation. So identify the risks and then try to mitigate them to make them less. Again, a formal approach, not just I'll do a bit of risk planning. We're going to follow a formal, documented, established system. Well, why do we need all this risk management? We've never had it in the past. What do we need all this messing about for? Last year, 21, during COVID, 80% of medical supply businesses were disrupted. They completely disrupted. Many went bankrupt because they'd done no risk planning. COVID completely disrupted them and they went out. And we see less than 15% were actually prepared, were ready. Let me just ask you now, your computer systems, most of you have got logistics management information systems, LMIS. How good is your cyber protection? Most machines I've ever seen, there's no antivirus, there's no ransomware protection, there's no cyber protection. What would happen if you got a ransomware attack and they stole all your data? How would you recover from that? Have you got the planning? Have you done any risk management at all around your cyber facilities? And the answer for the public sector, not just the health supply chain, but the whole of the public sector, whether it's education or roads or transport, is no. They haven't done anything. They haven't even ever considered the risk. What does a little bit of antivirus software cost? What does a little bit of anti-ransomware software cost? That kind of identify the risk and mitigate the risk is why we need risk management. Globally, nearly all our supply chains, and especially in public health supply chains, have become international. They've become globalized. Most of the medicines we buy are from India. But where does India get the API, the active pharmaceutical ingredient, to make the medicines from? Well, actually, it gets 70% from China. So if China's disrupted, Indian pharmaceutical manufacturing is disrupted. And just where in China makes the API? It's a city called Wuhan. And I'm sure before COVID, no one had ever heard of Wuhan. But that's where the API manufacturers are located, the start of the COVID epidemic. So these are the kinds of globalizations we've got. We buy from one country, who buys from another country, who buys from another country. We have these huge globalized supply chains in just about everything we do, whether it's medicines or catheters or diagnostic kits or even malaria bed nets. One piece comes from here, another piece comes from there, all around the world. And this has made our supply chains very brittle, very fragile. We get very low cost, it's efficient, but it's not resilient. The slightest disruption and we're in real trouble. And we haven't identified this. We haven't looked at the risks that we're taking when we get these very low prices. So my key point around this is supply chain risk management is not just pandemics. It's not just planning for an Ebola outbreak or a volcano or an earthquake. There are many risks in normal healthcare PSN. Transport risk because of the globalization. There is a port strike, can't unload the ships. There is a pilot's strike on the airlines, can't move by air freight. Lots of things can go wrong. And we can reduce the risk to us. We can reduce the disruption by risk management. COVID didn't create most of these risks. It highlighted the problems that already existed. One of the key points around this is in public health, we have a much greater risk than in the commercial sector. When they're out of stock, they lose sales, they lose money. When we're out of stock, we lose lives. People die and suffer. We increase morbidity and mortality. So we have a very different risk profile to the commercial sector. So a lot of the risk management which has been made for the commercial sector is not appropriate to us because our risk profile is very different. They're dealing in dollars, we're dealing in lives. So we have to look very carefully at risk management appropriate to what we are doing. So what does this mean? We have to integrate risk management into supply chain management. We can't operate it as a separate function. The two have to go together. Risk management must be part of public health supply chain management, an integral function, not something off on one side as it often is in the commercial sector. We have to make it part of our mainstream operation. So what's involved in this risk management? Really, we start by identifying the risks. What are the risks? We try to analyze the risk. How likely is it? What would be the impact? Then we evaluate the risk. How serious would it be if this happened? And then we decide what to do about it. Maybe we just have to say we accept it, or maybe we have to say we try and mitigate the impact of it. We can't stop a volcano. I don't know anyone who can, but we can be ready. If it happens, we can have extra supplies available in strategic locations to help recover from any damage it might cause. So we have different approaches to how we address risk, but identify, analyze, evaluate, and then mitigate is our fundamental activity. So our overall approach is to start with a clear idea of what we want to do. And often people don't. They go straight into risk management and all the detail without stopping to think, what am I trying to do here? And some just plan for natural disasters. Well, okay, that's useful, that's helpful to have a plan for natural disasters. But there are many normal supply chain risks that we could plan for, and we could mitigate their impact as well. So really, we're trying to make our supply chain more reliable, more resilient. That's our overall activity. And again, I come back to this mention of cybersecurity, which has been very sadly neglected in most areas. And when we talk about risk management, we're talking not just about any risk management, but in particular, ISO 31000, a recognized quality standard for undertaking risk management. And that's important that we work to a recognized quality standard. We would never buy medicines which didn't have a clear quality standard. We shouldn't undertake management functions which don't have a clear quality standard. So ISO 31000 is our quality standard for undertaking risk management. And it follows exactly the same steps I've just outlined. Identify the risk, analyze the risk, evaluate the risk, and then seek to treat the risk. Well, why do I need this ISO? ISO is a lot of paper, you know, it's tons and tons of documents and paper. Why do I need all of that? Well, there are a number of reasons. One is if I want to attract any donor funding for undertaking risk management, I've got to have a clear quality standard. Another one is if I want to stakeholder confidence, if I want people to trust my supply chain, they need to know that I'm working to a management standard. And then financial recognition. People will place orders with us, people will trust us if we are clearly observing recognized management standards. So just like in medicine, we want a recognized USP, BP product standard, so in management, we want the ISO recognized standard for risk management. So in this first part, just the introduction, let's understand that risk management has long been neglected, and we must try and bring it forward now as part of our normal PSM operation. We've got to think with a patient focus, not the commercial sector, how many dollars. We will look at the cost, but fundamentally we look at the mortality and morbidity first. Patient focus, that's why we're in healthcare. We're going to try and follow the ISO standard for risk management and understand that it's a bit different to the commercial sector, and understand that risk management is as much about preventing problems as it is about disaster and emergency crisis management. We don't have to wait till a disaster arrives to be ready for it. Okay, this is our first Q&A session. Gladness, do we have anything in the chat box? Do we have any questions already? And if there's anyone who wishes to speak, please raise your hand.
Yes, please. If you have any question or you want to contribute, any question?
Okay, let me start by asking then, how many of you received any training in risk management for PSM? Has anyone received training in risk management for public health? Okay, I see Kagwa Andrew.
Yes.
Please
Hello.
go ahead and speak.
Yes, Kagwa.
Hello.
Yes, go ahead.
Yes, thank you so much for the presentation. For me, it gives me a chance to think through the things that I really love thinking about. I wanted to introduce two concepts in this whole discussion. One being the aspect of technology. Is it an enabler to supply chain risk management, or is it a distortion? If it's an enabler, how can we piggyback on it to improve supply chain risk management? If it's a distortion, how can we manage the challenges that it brings on board for a supply chain person in as far as managing risk is concerned? Then in the aspect of supply chain management, risk management, how can we introduce the aspect of sustainability? It's a big issue in supply chain management of late, and I would want to think that even as we manage risk, we need to think about it, the people, the planet, and other issues that move with sustainability. Thank you so much, Professor.
Okay, so I'll respond to those first. Technology, the simple answer is it's both. It's both an enabler and a distortion. It's a distortion when we've got lots of new products, lots of new medicines. I have to adapt my supply chain to manage them. And that's a risk that I have to try and manage. So many of you will be aware of new rapid diagnostic tests. They require a lot more volume, a lot more warehouse space, a lot more distribution capacity, a lot more transport. That's a problem for me in the supply chain, and I have to try and prepare for that, and I can use risk management to do it. Technology can enable risk management and reduction of risk by helping to collect data. What is actually happening? Where am I out of stock? How can I transfer and move stock? So the answer to the technology, it is both. Sustainability, I'm going to be very bold. I'm sure I'm going to upset a lot of people now and say, no, it's a step too far. Right now, our public health supply chains are so brittle, are so fragile, that we have to focus on resilience. After we have attained resilience, then we can move towards sustainability. Sustainability is a jump too far at present for the vast majority of our systems. Build resilience first. That's going to take us 5 to 10 years to build resilience. So sustainability, yes, off in the future. Very much needed, but we have to focus on the here and now, and that means resilience. Okay, if there are any more questions or anything in the chat box, please.
Yes, please, Prof. There is one question. The question is, what is the role of ISO in medical procurement quality control?
Right, well, in fact, ISO is probably superseded by the UN model procurement. So that is more detailed than the ISO, and I would recommend that you use the UN multiple agencies model procurement as the guideline for undertaking procurement rather than just ISO. ISO is general, it's not specific for public health product procurement. The UN multiple agency model procurement is, and that's the document, that's the guideline to use, because that is specific for public health procurement.
Okay, thank you, Prof. Maybe you continue.
Hello, Doc.
You have a question?
Yes. I think coming to the issue of risk management, just thinking aloud in terms of, I'll just give an example of some procurements. For instance, in the case of medical supplies. Hello.
Yes, go ahead.
Yes. In terms of risk management, I see it is very important, because we have come across where we have procured some reagents. At the end of the day, we start now realizing that they are having some chemicals, for example, like for cartridges for expert testing for HIV, SARS-CoV, and the others, whereby you really start realizing that there are chemical which is called GDC, which is carcinogenic, and it is not environmental friendly. So I'm looking at in case of some risks that are associated by waste in this case of the cartridge, and as well as also from your your explanation, how can we maybe deal with where we have problems with some reagents on chemicals that are not environmentally friendly in this case, as far as risk management is concerned?
I think that's really a waste management question. We have separate webinars for waste management, but the risk element is to determine what is the risk. What is, we say carcinogenic, what is the volume of these diagnostics? What is the volume of the reagent? We make a risk management calculation on that volume. And I can say for most low and middle income countries, it's almost negligible. That doesn't mean we can just throw them away, but it means that we can have a very simple waste management process to handle them. Let me give you a simple example. Do you have any cement kilns in your country? Do you make cement?
Yes.
Right, then it's easy. We use the cement kiln, we load in the waste cartridges. Within 3 minutes, the carcinogenic compound is utterly and totally destroyed. I don't need to spend millions on a special incinerator, which I'll only use a few days a year and which will break down from lack of maintenance, and no one can afford the fuel anyway. I can just go to the cement factory and in 2 or 3 minutes it's done, because I've done a risk management approach. I know I've calculated what the volume of the carcinogenic compound is. I've looked at the best way to dispose of it, and I've said for this volume, the risk is in this category and I can handle it this way. And that's how we approach risk management. People panic when they hear carcinogenic. What is the actual risk? Diesel is carcinogenic. Do you want to ban diesel fuel in your country? No. How do we manage it? What is the risk? We measure the risk. Then we can determine how best to reduce the risk and manage it. And that's the key point of risk management. Identify the risk. You've identified it. It's a carcinogenic compound. Now we go to analyze the risk. How serious is it? What are the consequences of the risk? And then how can I mitigate? How can I reduce that risk? That's the risk management approach. In the waste management courses we run, we do more details about how to actually destroy of such products. But first we do the risk management. What's the risk? Then how to destroy it. Okay, I think we can have just one more question and then we'll have to move on.
Okay, there is a question which says, what are the issues of compensation in terms of medical drugs in relation to risk management?
Okay. Let me give you a simple idea. What would be the risk if you ran out of antiretroviral medicines? You would interrupt treatment. People would get drug-resistant viruses, which would be more expensive to treat. I would have to use second-line medicine. Some people would die. If I interrupt treatment for more than around 2 months, about 4% of the people will die. That's the risk. How can I mitigate that risk? By having multiple sources of supply. Right now, many countries still do a 100% tender. If that supplier fails, I'm stuck. Other countries, particularly South Africa and MSD, do a split tender award at 80-20. They have a second supplier. So if there's a problem, I can still get enough to get through for 1 or 2 months. That's how to mitigate the risk. I identify the risk. How serious is it? Well, death is pretty serious. Yeah. And then how can I mitigate it? And there's always simple, straightforward answers to most of the problems we encounter. We can't reduce every risk. I can't stop volcanoes or earthquakes or mudslides or floods, but I can be ready for them. I can mitigate the impact. I can mitigate how serious it affects us. Okay. So in Indonesia, they have 520 medical district stores. They lose one every month. Tsunami, fire, earthquake, or volcano, because they live in a geoactive area. They have lots of volcanoes. It's not a problem because they immediately replace it. They have inflatable stores that come and they have extra buffer stock at central level. And within 7 days, they've got a new medical store replaced and operational because they've measured the risk and they have mitigated the risk available. We need to be thinking along similar lines. What's the risk? I can't control every risk, but I can reduce the impact. Okay.
Thank you, Prof.
I think we better move on now because I'm very aware of the time. Yep.
Maybe you continue and then
Yep.
we
Okay. We still got sound okay? Yeah. Yeah, okay. Okay, so part two, how do we actually understand that? So the first one is to understand what we want from risk management. What are we trying to achieve from risk management? We've got very fragile systems, and we've got to change that. But when we come about this change, we have to do it with reality, and a key message I'm going to bring is balance. Come back to a balanced approach. We've allowed our supply chains to become unbalanced. We've gone too far on efficiency and not considered resilience. They're too fragile, they're too brittle. We can use risk management as a tool to help to bring us back into balance. And that's what we're trying to achieve, a balance. I can't remove all the risks, but I can help to mitigate the risks and come back to a balance. Classically, as I increase efficiency, I reduce resilience. So I can get very low price medicines, but I've got to buy them from 10,000 kilometers away, halfway around the world, with a very long supply chain to do that. And that's not very resilient. If anything happens to the ship, or if it's delayed, or the land transport from the port is a problem, it's a real issue. So as I increase efficiency, I reduce resilience. Point here is to come back into balance. It's not that I want all resilience. I can't have that. But I've gone too far in the past 10 or 15 years for efficiency and not considered resilience. I need to come back the balance to balancing some of the efficiency. Maybe I have to pay a bit more using 2 suppliers instead of 1 to bring me back into balance. Key point here is balance. Because of COVID, everyone has said, oh, we're not resilient. We must become more resilient, more resilient. And that's true. Not just resilience. I must have the balance between efficiency and resilience. I don't want 100% resilience. I want a balance. Yeah, can we ask you to go to mute, please, if everyone can mute? So keep this in mind. I want balance. In the post-COVID clamor, there's far too much around resilience. I must improve resilience. I must do that, but not at the expense of losing all the efficiency. I want to come back into balance between efficiency and resilience. Okay, so how am I going to do this risk management that we're talking about? And there's 2 approaches, qualitative and quantitative. Unfortunately, the vast majority of our public health supply chains just don't have the data and the information we need to be able to do quantitative risk management assessment. We hope we'll get there. We hope as better and more computerized systems are implemented, we're there. But also, we don't have the background of management knowledge in our public health supply systems to be able to use the sort of formula that's there on the bottom of the screen. And that's okay, because I don't need to do that. I can use a qualitative approach using a Delphi method, a Delphic committee, committee of people who are experienced, who are going to give me their best assessments. And that's going to be good enough to get started and take care of a lot of the problems. Later, when I have better electronic control systems in place, I can look at developing quantitative techniques. But for now, I'm going to talk about the qualitative technique, because that's where most of our public health supply chain systems are operating. So this qualitative approach, I'm going to use rating scales. Again, can I ask you to mute, please? Can I ask everyone to mute, please? So I'm going to look at a simple scoring chart, which I'm going to explain to you. How likely is this to happen? What's the probability? What's the consequence? What's the impact if it does happen? I'm going to put that together in a risk matrix. So I'm going to use a logical, systematic process to develop this risk management. Let's understand there's always
Professor Andy, you are on mute.
Prof, you're on mute.
Okay, am I back now? Did you get the first few slides or not?
Yes, yes, yes.
Yes, yes, we did.
Okay, all right, thank you. I don't know why that happened, but okay. All right. So there's no such thing as zero risk. It's impossible to completely mitigate every risk. I can reduce the risk, I can reduce the impact, but I can't remove it. And I have to think about the cost of the risk mitigation. So I could reduce the risk of being out of stock by having 4 years buffer supply. Can I afford to have 4 years? Does it make economic sense to have 4 years buffer supply? So let's understand again the need for balance between the cost of mitigating the risk and the impact of the risk itself. And an important factor here is, as I get to less risk, the cost goes up. So the big risks, I can actually mitigate them quite cheaply. But the little risks, they're very expensive to remove. So I talk about my risk appetite. How much risk can I accept? Can I risk being out of stock for a day? Well, most places I could manage a day. It wouldn't be too much impact. Yeah. If I say I can't be out of stock for a day, then that's very expensive. I need a lot of buffer stock, a lot of backup to achieve that. So I have to try and balance the cost of the risk mitigation as well. To do that, I'm going to use this ISO 31000 process. And I start by establishing the context. What's the environment I'm working in? So have we got a written health policy for the country? Well, yes, of course we have. But have you read it? Do you know what it is? Do the people in PSM clearly understand your health policy? What's the priority? Is the priority communicable diseases and malaria? Or is the priority non-communicable diseases and cardiac problems? Read the health policy. National medicines policy. Who's paying for all the medicines? Because that affects the risk. If a donor is paying, they can stop funding at any time. That increases my risk effect. How much data have I got available? And what can I do? And financially, am I secure? Am I know I've got funding to do what I want to do? The overall environment is our first one. And the main point there is to be aware of it, to know about it, what I'm operating in, what are the parameters I'm trying to achieve. Then I'm going to identify the risks. What are the risks I've got? And the problem is there's lots of risks. There's hundreds of risks. So in order to make sense of the risks, I usually put them into categories. I don't try and list every single risk out. I would have hundreds of pages. So I put them together into groups and into categories. What's the risk of a trade war? What's the risk of my rising demand. Suddenly I need a lot more supply. What's the risk of climate change? And I put all these risks together in different categories, and I consider the category of the risk rather than every individual risk. So disruptions. What's the risk of a volcano, earthquake? What's the risk of a national strike? What's the risk of one of my suppliers going bankrupt? Delays, systems, forecasting. My forecasting is no good. I got the wrong quantity. I need extra, I need emergency procurement. What are all the risks involved in this? And I take them by this category. What's the risk around procurement? What's the exchange rate? Raw material problems? What's the overall global market? What's the long-term versus short-term contracts? How many customers have I got? What's the inventory? What's the cost of extra capacity, more warehouse space? Putting together all the risks into categories. Then I'm going to try and evaluate, to analyze the risk. First one is, how likely is it to occur? And second one, what's the impact? And I'm going to score them 1 to 5. As we come to the QA session at the end, just start thinking about now, how are you going to put this Delphic team together to do the scoring that I'm going to talk about next? Who's got the knowledge of international supply chain and medicines? Who knows about where India gets its API from? Who knows about what the global market trend is to be able to do the risk management? And then when you've done it, how are you going to convince the ministry to give you all the money to mitigate the risk? Just start thinking about that for when we come to the Q&A. Okay, so this is the scoring matrix. And then how likely is it? So if it's very likely, I'm going to score it 5 points. And that means it's going to happen twice a month or more. If I'm out of stock twice a month or more, that's very likely to happen. Okay. And then at the bottom, I've got a score of 1, which is rare. Once every 7 years or 10 years, it might happen. Very rare. What's the chance the ship is going to sink? Well, that's very rare. The ships don't usually sink. It's probably a 1, yeah? So I'm going to score on this scale, going through with my Delphic committee, my team of people who are experienced in supply chain, who've been in for 4 or 5 years and know how it works. How likely is it? Score a 3, maybe once a year, I'm going to have a problem like that. 5, very likely. That's my first scoring table. How likely is it to happen? My second scoring table is what's the impact? So if it's massive and irreparable damage, more than 1 month out of stock, patient life is threatened and well-being. So if I'm out of stock of antiretrovirals or antimalarials, people could die. That's irreparable. So that's a 5. I'm out of stock of paracetamol, nobody's going to die. It's a bit inconvenient, it's not very good, but it's not irreparable damage. So I look through my list and I go for each one, what is the impact? Less than 1 day out of stock, for most medicines, it wouldn't matter, would it? That would be just a 1. So I score again 5 to 1 based on the impact. How serious is it going to be? Then I put these 2 factors together into a matrix. So along the top, the consequences. Scored 1 to 5, 1 insignificant, not much. How likely is it to happen? 5 means it's bound to happen twice a month. And I multiply the 2 scores together. So 5 times 5, major impact, irreparable damage, and very likely to happen, that scores 25. Very rare, scores 1, insignificant, amount of stock of paracetamol for 1 day. It's not a big problem. That scores a low 1 in the green towards the bottom left. That's my indicator scale 1 to 25, based on the likelihood and the consequences. Now, what am I going to do about it? So if I'm scoring 20 to 25, I've absolutely got to take notice and I've got to do something about that. If I'm scoring below 5, well, it'd be nice if I could get to it, but it's not my priority right now. Right now, I'm up there with the 20-25s and the 10 and 20s. Them first. Focus on those. Reduce the risk, mitigate the risk around those areas, because they are the critical ones. Okay. If it's scoring 5 to 10 and below 5, it can wait. I'll get to it in 2 or 3 years' time once I've got the major problems. That's the point about risk management. It brings me a focus. It brings me back into balance. I'm addressing the critical areas that need the most attention. Then think, well, what can I do about it? How much control do I have on the situation? If it's a volcano, I've got no control at all. I can't stand there and tell the volcano to stop or the earthquake to stop. So that's no control at all. That's a 1. If it's under my control of PSM, then that's a 5. Complete control. I can do something about that. I can monitor, reduce the risk of expiry because I'm monitoring the stock. I'm rotating the stock much better. That's under my complete control. So again, a scale of 1 to 5 that I use to address, I use to focus. Where can I do some good? I can't stop the volcanoes. I can be ready in case it happens. But I can't stop them. I don't have control on them. Recognize where you can be effective, where you can focus your efforts. So common risks, do you have any control at all? If there's civil unrest, you can't really control that. But again, you can be ready for it by decentralizing some of the stores, having them in different places. If you've got lack of funding, it's very difficult to address that. But again, we can try and be ready for it. We can try and build capacity, multiple donors. Delaying program implementation, it's a problem. I've got some degree of control there. I can hope to move along a bit. So focus on the areas where you've got control and where there's a big impact. We look at the situation in the Philippines. They were out of stock of anti-TB medicines for over a month. Around 600 patients died because they were out of stock. That's a real problem. That's a real issue. 600 people died. And a lot more got MDR-TB, and I had to spend a lot of money on MDR-TB. I need serious risk mitigation. That's a 25 on my score. I have to have enough buffer stock. I have to control the supply chain really fixedly on those items. Bring risk management to make the focus. Where you've got the biggest problem, where you've got the biggest impact and consequence. Here's an example of a risk management assessment. What can you do about it? You can try and diversify procurement. You can look at monitoring the risk, developing a contingency plan, lots of issues around what we can do. It's not that difficult. Basic risk management is straightforward. We can make it happen. Okay, time for the second Q&A session now. Gladness, do we have anything in the chat box for us? Or if you would like to raise your hand, please.
Yes, please. Any question? If you have a question, please raise up your hand.
Gladness, we have a lot of them in the chat box. Do you want to take up some of them? Prof. Andy, we have a question here.
Yep.
That COVID-19 vaccines expiring due to low uptake and due to few adverse side effects. Unfortunately, these reactions are not reported and the government could not act to public opinions. How do we promote pharmacovigilance in the context of PSM? Is this relevant here? I'm not sure, but yeah.
Right, that's a bit of a difficult one for me. I think low uptake is not really related to pharmacovigilance. Pharmacovigilance would really be around the safety of the medicine, but maybe public perception, the public perceives it as being unsafe. So that would be one issue there, but not really. I mean, low uptake, yes, that's part of the risk. It's part of the risk management. The difficulty around COVID vaccine is we haven't had a lot of control. We've been given material without really being able to understand how much we could use. And that's a problem. We couldn't forecast, we don't know, it's an entirely new product. The public is fickle on their uptake, some want it very much, others don't. It's a difficult one. So there we have to be able to accept we're going to have expiry and we're going to have to destroy stock. That's part of the risk, and the risk management around that is having waste disposal in place to dispose of it safely. But the risk management, again, in accepting large donations when we're uncertain of the uptake. We don't have a lot of control. We can only control certain areas. We have to try and mitigate the impact, which would be waste management in most cases around that. It's not very good, I know, but that's probably the most we can do when we don't have control.
Okay.
And COVID vaccine, even now, we don't have control.
Definitely. Prof, there's also a question which says risk avoidance or risk transfer. Which one makes more sense?
Right, it depends on the individual circumstances. Let me look first at risk transfer. Distribution is a problem. Why don't you transfer the risk to a commercial distribution company? Does that make sense? That would transfer the risk out of you. Yeah. But can you trust a commercial distribution company to deliver? Can you trust them to be effective in their operations? Risk avoidance, you would increase, you would make greater distribution resources available. And you would distribute more frequently, rather than once a year, one big shipment, multiple times throughout the year, multiple different routes of distribution. So you help to reduce the risk, you avoid the risk. It depends on the circumstances of the country. There's no simple answer. You look at the specific issue, what is the risk? How can I best treat it? There's a whole separate webinar on how we treat risk. Today, I've only explained a little bit about how we identify the risk and measure it. The next part is how we reduce the risk. So how we do that depends on the individual activity. Some I avoid it, some I can eliminate it.
So if I get you clearly, is that it really depends on the context in which someone operates. You know, like in certain situations you need to avoid, in certain situations you need to transfer, and all these kind of strategies, right?
Yeah, let me give you an example of malaria bed nets. You're only going to distribute them once every 2 or 3 years, yeah?
Yeah.
If I put them through my normal supply chain, I risk disrupting the whole of my supply chain with this huge volume of items. I'm only going to do once. Perhaps that's better to transfer the risk to a private sector distributor. But maybe I say, why am I doing distribution? Why don't I outsource all the distribution? That would then remove the risk, eliminate my risk. But not really, because can you trust a distributor to do that? A one-time distribution, not so bad, not such a big risk. But delivering medicines every month, that's a big risk to outsource, yeah? So which is the better for bed nets? Probably outsourcing, because it's a one-time big volume drop. For essential medicines, keep it in-house.
Thank you, Prof. Maybe as someone from MSD, Medical Stores Department, can you share your experience? Maybe on the different types of risk that you face Maybe Prof, I can ask, what about the political environment? How do we consider it? Because let's say if we operate in a public setting, you know, there's this, the political influence, the political factors in the environment that you are operating in. How do we bring it on board? Is it because it's something that we cannot control? Yeah. Being a supply chain manager, let's say, yeah.
No, we can't control the political environment, but we can look at various issues. One of the political environments might be you're going to have elections. Perhaps during elections, there's extra transport, there's more people moving around on the roads. I can try and mitigate my risk of disruption, okay, by planning ahead, pre-distributing before election time. For political environment in chopping and changing decisions, that's much more difficult. I just have to try and work with what there is. I can't control it. I have to accept it and try to prepare for it. If I know my environment is unstable, I increase my buffer stock. I increase the security. I increase the resilience. I don't go to sole source. I use multiple source for all items.
Thank you. Any other question? Maybe you continue, Prof.
Okay, that's the end of the presentation. I've got Kagwa Andrew here with his hand up, and Felix. We'll perhaps take Felix because we've had Kagwa already. Felix, if you'd like to unmute and speak, please.
Okay.
Hello, Prof.
Yes.
Yes, thanks, Prof. I'm just interested to actually also know if we have an ISO, that's for quality management system, related to procurement and the supply chain. Why am I saying this? It's because some elements that are concerned with risk management, it also aligned to also availability or adherence to ISO. And now in this case, that's why I'm interested actually to learn if there is an ISO related to procurement and supply chain, which might be also key to align better in the way availability of documents, records, and all the processes that can also minimize in terms of some risks that may be also avoidable. Over.
I think medical stores should answer the questions because they have ISO certification.
Yeah. Medical stores, MSD, can we hear from you?
Okay, just while we're waiting for MSD to come to us then, basically, yes, there is. Generally, we tend to follow the good practices. And that makes it sound quite general, but in fact, there's a series of published written practices called the good practices from World Health Organization. So there is GPP, good procurement practice. There is GDP, good distribution practice. GSP, good storage practice. These are all 90, 100-page documents with the detailed specifications and quality requirements for the management of these operations, specifically for public health supply chain. So those are the goods, the GSP, the GDP. There's also GLP, good lab practice, good warehousing practice, all there. But there is an ISO, and medical stores MSD has the ISO qualification for their operation. So if anyone from MSD would like to share their experiences with us, please.
Prof?
Yep.
Maybe we take, oh, sorry, I lost the question, but
Okay.
it was, someone wished to know on how to deal with the risk that comes from medical equipment.
Risk for medical equipment, okay. There is a recent WHO publication on MDDE, medical devices and diagnostic equipment. I think there are 18 WHO publications which list them as well. Risk management for medical equipment, we use the same approach, exactly the same system. We use ISO 31000, except the technical aspects, when we come to the Delphic committee, are different, and we use the WHO MDDE guidance on that instead of pharmaceutical guidance. But exactly the same risk management approach, just the technique of how we do the Delphic committee is different. So if we look at medical equipment, we might take an X-ray machine. How likely is this machine to damage anyone? Well, X-rays can cause serious damage, so it's important that we look at the risks around monitoring and regular maintenance on that equipment.
Okay.
But exactly
There's
the same.
another,
Go ahead.
yeah, there's another question which says how risk management is important to handle counterfeit drugs and substandard drugs to countries procuring drugs. Maybe
Okay,
which steps do we use to control?
Right, counterfeit drugs are a risk, and we measure that risk in there. So usually during the procurement, we look at what is the risk we have during the procurement, and one is to receive counterfeit or substandard product, and we measure that risk. And there are 5 or 6 techniques we can do to reduce that risk. A simple one is secure source. We buy it from secure source. Regularly, countries ask for GMP certification, good manufacturing practice. That's a good start, but we need to go a little bit beyond that. WHO has a pre-qualification system for some medicines and some diagnostics, and we should be buying from the WHO pre-qualified suppliers. Then we greatly reduce the risk. And let me say, reducing the risk is very cost effective in these cases. So reduce the risk by secure sourcing and by seeing where we place the orders. That's the biggest one for counterfeit, but also undertaking a full quality assurance program. All of those who've got a Global Fund grant will know you must do quality assurance. Well, you're doing it for the Global Fund medicines. Why aren't you doing it for all medicines? Well, because it's very expensive, but there are low-cost ways now to do that. Low-cost screening ways to identify counterfeit medicines, and we cover that in the quality assurance of medicine courses. And basically that is with the new handheld Raman laser spectrometers. And if there's anyone on here from National Medical Regulatory Center in Nigeria, they will know all about it because they are using it to identify counterfeit medicines at customs.
Yeah. I can see a hand.
Okay. Kagwa Andrew, yes, please go ahead.
Thank you, Professor. The topic is quite interesting. I love it. I wanted to add something from my experience as a supply chain manager at PSI a few years ago. Ideally, the starting step in risk management is accepting that there's a possibility of risk. The moment you accept that, then it gives you positivity in all endeavors that you put in place to try to handle. Now, one tool that supports this process is what you call a risk register or a risk log, where you are able to incorporate the equation you gave us earlier. That risk is a function of possibility of something happening and the severity that it causes if it happens. And this is a very big tool that helps where you identify the risk that may be in place, the probability of occurrence, the degree of severity, how you're going to mitigate it, and who is responsible and by when. When you have such a tool, it can help you to manage a number of issues that may come up in the supply chain. I think it's a good tool that can be used. But also to comment on our earlier aspect of sustainability, I thought that at the basic level, it is possible to incorporate sustainability in the risk management process. Examples would include, if I'm trying to manage the risk of expired drugs getting back to the market, what can I do? I can use disposal methods that are eco-friendly, that are not going to be a hazard to the environment. If I'm doing inventory control to manage a risk of stock out, I can use a technology-based system as opposed to a paper-based system. Or if paper must be used, I can focus on using recycled paper as opposed to non-recycled paper. Hence, at a lower level, introducing the concept of sustainability in the management of risk. Thank you so much. I appreciate, and just like other members, I would be glad to receive a copy of the presentation that you've given. I wish you well.
Okay, I think the point around sustainability is it's a long-term goal. Yes, you can look at more eco-friendly items, but if we take the situation of medical device packing material, so wrapping for catheters, for bandages, for dressings, Europe tried to make them fully eco-friendly and abandoned the effort because it was just a step too far at this time. To make food wrappings eco-friendly, that makes sense. For medical equipment, medical devices, pharmaceuticals, the sterility requirements, the other requirements are just so strong that it's very difficult to become fully eco-friendly at this time. Yes, we can make steps towards sustainability, but again, I'd come back to my main point. Let's try and get resilient first. Let's move to that because we're so fragile. The slightest thing disrupts our supply chain. Let's get the resilience, and then we can build the sustainability. Not against sustainability in any way at all. It is necessary. We do need to move towards it. I just think the priority should be resilience. Okay, I see we've got another one. Kake Zimbwe. You'd like to unmute, please?
Yes, good afternoon.
Yep.
Yes, I'm Kake Zimbwe from Tanzania, Dodoma, the capital city.
God, excellent.
Yes, thank you for presentations, very insightful. And it's good for us who are working in the hospitals institute, whereby we manage a lot of commodities, medicines and other, which is, when we look nowadays, we know that the technology of the management of disease is becoming very high. We use high-tech medicines, we have the development of technology, we have expertise. So the whole process of a treatment or therapeutics is very complex. And the management of the commodities, medicines, and other supplies is very crucial nowadays. So one thing which we lack in our centers, especially in hospital settings, in supply chain, is the training of the new staff after recruitment. This is very important in order to minimize the risky, especially in issues of expiring of the product. At the same time, we have to train even not only pharmacists, even prescribers. We know that some prescribers of the medicines, they can focus on only one molecules or brand of the drugs, which can affect the movement of other supplies, even for devices or medicines, which can be the cause of maybe sometimes for expiry and sometimes for rejections. But if you look back, the medicine is within the essential medicine list. It have been stocked by the medical store department after our forecasting and the quantifications. So far, in going back, it can cause a lot of the expenses and sometimes losses. So it's very important, even us who have we can manage or we have the ability to train for new recruited staffs. But not only for the already in services staffs, it's very important also to train them, to know the revolving of technology, the treatment of therapeutic plants are very different. Emerging of new molecules, devices, and the science is growing too fast, especially in terms of therapeutics. And this is, we look in myself, in my expertise of the oncology, we know we have a lot of new drugs inside the pipeline for treatment. So I encourage you for other staffs, who managers and the other directors to invest more on the in-job training after recruitment for new staffs. This can reduce a lot of risk, especially for expiry and even for damage and other, maybe the drawbacks, especially for those like in antinoplastics and other things. Very important, these things to have the on-job training in service and for new recruited staffs. Over to you. Thanks.
Okay, training, well, that's our lifeblood. That's what we do on the screen now is number one, and number two, training courses. We have lots of them. I estimate there are 30,000 people in the world who need training in public health supply chain. So we have a long way to go, but we do have the training courses available. They are there. For new staff, absolutely. Need training and pharmacovigilance and understanding of the impact of what they do on the supply chain. I think we're out of time. Gladness, do we have time, or is that the end?
Yeah, Prof, if you want to wrap up, maybe if, I think we had the last slide.
Yeah.
We have a, yeah,
think
Gladness, we
you'll
have
have
a post-webinar. Yeah, thank you.
Okay, if you go to the webinar feedback, the poll, please, then.
I'm sharing the poll.
Good.
Thanks, Preksha.
Poll is on the screen.
Please, can everyone try to fill this poll? It's just a feedback sort of evaluation of the webinar. Thank you. Note that you get your certificates directly through your emails. Thank you. Yeah, maybe it's enough. We have more than 70% of the people who filled the poll. We can end the poll now. We can end the poll. Okay, thank you everyone for participating in this post-webinar poll. And there was a question on whether this webinar matched your expectation. 97% of those who filled the poll indicated yes, and 3% indicated somewhat. Okay. The second question, how likely are you to recommend the webinar to others? And in a scale of 1 to 10, 78% scored 8 to 10. The likelihood that there's high likelihood that they will recommend. Will you join us for the future webinars? 99% said yes. Thank you very much. If you've taken any course with Empower School of Health, 65% indicated not yet, but they are interested. So maybe someone from Empower, you can send an email in the chat box so that they can continue reaching you. And then there is, yeah, so that was the last question. And we thank every one of you. And we hope to see you in the future webinars. We are expecting to have more and more of this kind of webinars because they are part of on-job training, skills upgrading, and even creating awareness as far as strengthening our supply chain management capacity. So we welcome you again, and we thank every one of you. And you get your certificates through the link. There's a link which has been shared through the chat box, so you can go through the link and get your certificate. Yeah, thank you everyone. And now we can have we were shown the e-learning courses on procurement and supply chain management for public sector staff, managing public health commodities in Tanzania. Yeah, these are modules that we have developed, and they're going to be e-learning modules Yeah, they are specifically developed for MSD and TMDA, but we are looking forward to negotiate with the national e-learning platform of the country so that these materials can also be there. So anybody who is interested, they can actually access these materials. So we have a module on warehouse and storage management, distribution management, fleet management, product knowledge for non-pharmaceutical staff, inventory and stock control management, data analytics, pharmacovigilance, risk management assessment, marketing authorization application assessment, periodic surface update reporting, good distribution practices, and good manufacturing practices. So all of these are quite very basic, but they are really creating a good knowledge to the person who really want to upgrade their skills. So we are going to have these modules being launched, I think, by end of September. Yeah, thank you. So we also have the programs with Empower. As it has been said, we have a master's with Empower. So please, the registration is open for October batch. For this year, please, you can continue with the registration. Thank you.
Sonia, are you there? The call?
Maybe they can share the link or an email for contact if someone wants, because there were people, 69% were interested in these courses. So please share the link so that they can really contact directly the Empower officials. Yeah.
Sure. Preksha, can you confirm if Sonia is there? She can just give a brief background of the course.
I don't see her.
Yes, I'm checking.
Thanks.
Yes, Sonia is
Just
here.
1 minute.
Sonia, I think she's unable to unmute herself. Sonia?
Yeah, I'm here. I was unable to unmute myself. Yeah, hi
Okay,
everyone.
please, can you share your email or contact so that those who are interested, they can reach you, or they can reach the respective office from Empower?
Yeah, thank you, Gladness. So my name is Sonia. I'm from Student Acquisition Department of Empower School of Health. On the next slide, you can see how many courses we are offering. These are the online courses that we have. The masters we have recently launched. This is in collaboration with UNITA, and we have 2 categories under masters course. That is 24-month, 12-month. You can please visit our website to check the more details. Also, you can get connected to us on the email ID that is mentioned on the website. Along with masters, we have postgraduate diploma also, that is for 12-month course. Then diploma, this is for 6 months, and we have multiples of other short courses that is started from 1 month to till 3 months. Also, on the next slide, okay, there is another. There is a course on financial management that we have, co-developed for Global Fund, and we have almost 230 participants who have already completed this course. And this course is a free of cost course. On the next slide, these are also the certificate courses we have, short courses, and which you can complete in 2-month duration. These are available in English language. Please visit our website for any questions related to admissions, courses. You can get connected with us. Thank you so much.
Thank you. So the website is, yeah, you should just, or you can visit the website, or you can write operations at Empower. Okay, so you can just access them from there. Yeah, and they will be responding to you. But you can also contact me if you have any issue. I'm just posting my number. Yeah, you can use it for WhatsApp. So I have sent my number through the chat box. So you can always check with me in case you are interested. Yeah, and any more, like if you feel like you want to upgrade your skills, feel free to contact me or Empower directly. So with those remarks, we thank everyone. Make sure you have received the link for the certificate. It was posted through the chat box. Yeah, make sure you have it so that you can be able to access your certificate that you are requested to fill that your details through that link. Okay. Down. Yeah, someone already has their certificates by now. Thank you so much. Yes.
Gladness, I would just like to take a quick picture if everybody on the screen can turn on their videos. Thank you so much.
Are you done, Sharon?
Yes, thank you. Thank you so much, everyone.
Oh, someone says the link is not working. I think the certificate. Maybe it's just a connection or something because others are getting the certificates. If you fail, please contact us. Don't worry, just contact. Thank you so much. We hope to see you again in the future endeavors. Thank you. Thank you so much, Professor Andy. Always so good to have you on board. Thank you.
Thank you so much, Prof. Andy.
Okay,
Thank
bye
you.
to all.
Yes, Prof. You can have a word.
No, it's okay.
Thank you.
Bye to all. Yep. Namaste. Okay.
Yeah.
Thank you.
Thank you.